Now, would you know how to recognize whether a change in a fetal heart rate pattern was an emergency or not? What if you saw a deceleration in that fetal heart rate or an acceleration? Well, decelerations are drops in that fetal heart rate, and sometimes they're completely normal and other times they signal distress. And accelerations are increases in fetal heart rate. But what is okay and normal, and what requires you to use those stop-in interventions? Well, the key is knowing the type. And to determine the type, we assess the shape and the timing of that fetal heart rate change in relation to the uterine contraction. And this is where our helpful mnemonic, VEAL CHOP, comes in. So variable decelerations indicate cord compression. Early decelerations indicate head compression. Accelerations indicate everything is okay, and late decelerations indicate that we have placental insufficiency. So the VEAL is our fetal heart rate pattern, and CHOP is going to be the cause. So these in red mean we're in trouble, and those are the ones you would provide your stop-in interventions on. And those in green mean everything's okay, and we're going to continue to monitor. But let's dive in. So for our variable decelerations, it's important to understand this is different than variability that we discussed. These are deceleration. So this is a V-shaped fetal heart rate pattern that's independent from that contraction. So that means it can happen anytime, before, during, or after a uterine contraction. And these can happen from cord compression. So things like an umbilical cord prolapse, where that cord prematurely delivers before the fetus and is trapped between the head and the maternal structures. Or it could be just from a trapped cord. So when the NCLEX gives you a client with variable decelerations, what will you do? Well, if it's cord compression, then we want to relieve that compression. So this might mean lifting that fetal head off the presenting part and repositioning the mom. And of course, we'll provide those stop-in interventions.